Hey everyone! In this video, we are going to discuss an important organism, Bordetella pertussis. Bordetella is pink in color or gram-negative. It is a small, rod-shaped organism which is encapsulated. It has hands and legs and is motile. It is always surrounded by oxygen and is a strict aerobe. It has a flagellum-like structure on one end and is the causative organism of whooping cough. We are vaccinated against pertussis as a part of the DTP vaccine, which covers diphtheria and tetanus as well. Vaccines are administered to infants. It is important to remember that immunity decreases with age. Vaccinated adults act as reservoirs for Bordetella. It is then transmitted through respiratory droplets of these individuals. This organism is a mucosal surface pathogen who attaches to the nasopharyngeal ciliated epithelial cells. One of the most important toxin is filamentous hemagglutinin. This attaches to the ciliated epithelial cells and causes cilial stasis, making the individual hypersensitive to anything they may breathe in, thus contributing to the increasing coughing. The pertussis toxin aids in attachment to the ciliated cells and acts by the cyclic AMP mechanism. This causes efflux of ions and influx of water, causing edema. Other important toxins are adenylate cyclase toxin, which impairs leukocyte chemotaxis. This inhibits phagocytosis and causes local edema. Tracheal cytotoxin interferes with ciliary action and causes ciliated cells to die. Pertussis toxin blocks immune effector cells by causing hypoglycemia. This increases histamine sensitivity. Once you are infected with Bordetella pertussis, it takes 7 to 10 days of incubation where there are no visible symptoms of the disease and the individual appears to be perfectly healthy. In this phase, the bacterial load is minimal and gradually increases in the catarrhal phase. This occurs 1 to 2 weeks after infection. It is characterized by rhinorrhea, malaise, sneezing, and anorexia, which is usually mistaken for a common cold. In this phase, the bacterial load is maximum. It gradually declines as we enter the paroxysmal phase. This occurs 2 to 4 weeks after infection. Repetitive cough with whoops, vomiting, and leukocytosis are characteristics of this phase. This is where we usually perform tests, but it is very difficult to identify the organism. The whooping sound is caused due to rapid, deep inspiration amidst too much coughing. In children, bloodshot eyes and dehydration are common symptoms seen due to too much coughing and vomiting. In the convalescent phase, the bacterial load is greatly reduced. It occurs 3 to 4 weeks post-infection. It is characterized by diminished paroxysmal cough, secondary complications such as pneumonia, seizures, and encephalopathy. Damaged cilia also increase the chances of secondary infection. The diagnosis of whooping cough is usually done on the basis of clinical symptoms. Nasopharyngeal swabs or cough plates are cultured on Reagan-Low or Bordet-Jengaud media. Remember, it is difficult to culture the organism from mid-paroxysmal stage onwards. Other methods that can be used for diagnosis are direct immunofluorescence, PCR, and serological tests. To treat whooping cough, children are usually hospitalized due to a high risk of anoxia leading to death. In adults, supportive care is provided. Erythromycin is prescribed for 14 days to the patient as well as to all household contacts. Macrolides may also be used. As we saw earlier, whooping cough can easily be prevented by the DTP or DPT vaccine. Children are born with little or no immunity to this organism. Hence, vaccination is of utmost importance. I hope this video has helped you learn something about Bordetella pertussis. Don't forget to like this video and subscribe to our channel.